We have some really nice weather over the next few days as we go into the weekend. Of course, today looks very nice, highs in the 70s, lows in the 50s. But on the left, you can see on the top two pictures, you'll see the high temperatures forecast for Saturday and Sunday. So looking into the weekend. And then the low temperatures in the lower left, those lower two images, so in low temperatures. And so we're going to be back above normal as we go into Friday, Saturday, and Sunday. Some very nice conditions in the mid to upper 70s, even some low 80s on Saturday and Sunday, and low temperatures generally in the 50s for Saturday and Sunday. On the right are the chances or probability of precipitation. And so the upper right is the forecast. It does look like we're going to see another system start to impact our state from south to north on Sunday. And so you can see the probabilities of precipitation for the 12-hour period ending Sunday morning in the upper right. You see those numbers starting to increase as you go into Arkansas. And then on the lower right, those are the numbers that increase during the course of the day as we work our way into Sunday. It does look like showers and thunderstorms will be working their way northward through the day as we go into Sunday to a likely category of precipitation as we get into the afternoon on Sunday. This is the forecast of precipitation over the next 7 days. It does look like we're going to see some more significant systems impacting our state. Of course, the first one will be on Sunday and on into Monday. Then they're calling for another system by perhaps late into the day on Tuesday and Wednesday, so by midweek next week. But you can see anywhere from about a ½ inch anticipated in the northwest corner of Missouri to as much as an inch into an inch and a half over southeastern sections, even the 2-inch contour going right through far southeastern Missouri. So some notable rainfall. And I will say this time of year, we would anticipate some significant rainfall because May climatologically is our wettest time of year. Most locations in Missouri, the average is over 5 inches for the month of May. This is the forecast for next week. You can see those, I would think with the systems that are going to be impacting our state, that will mean more clouds across the area and keep those maximum temperatures from getting too out of hand. But nonetheless, near normal. Generally, this time of year, we would anticipate highs in the lower to mid 70s, lows in the 50s. And then on the right, that's the forecast of precipitation. And as I had noted, even though it says a slightly below normal probabilities over the western half of the state, that would mean even if you get a 3/4 to an inch of precip, that could still be a little bit right near to below normal because, again, climatologically, this is our wettest time of year. So it does look like these mild conditions are here to stay, at least for the next couple weeks or so. And some chances of precipitation starting on Sunday and again by midweek next week. But enjoy the weather over the next few days because it does look great for today, tomorrow, and on into Saturday. And Valerie, that's pretty much a weather wrap up. I'll hand it back over to you. Thank you so much.
All right. Thank you. We really appreciate you joining us each week. That weather report is really a valuable part of our program. Thank you.
Thank
Eric,
you.
Are there any questions for Pat?
I have none at this time.
All right. So we will move on now to our featured program. Dr. Craig Payne is an associate extension professor with the Veterinary Medical Extension and Continuing Education program. And he is going to talk to us today about fly control, deworming, and vaccination for the beef herd. And so, Craig, if you're ready, the floor is yours.
All right. Thank you, Valerie. I'll just do a sound check, make sure you can hear me.
Yes, we can hear you just fine. Thank you.
I've got a lot of ground to cover in the next 30 minutes. If I was to do each one of these presentations to the level of detail that I normally do, they would take 30 plus minutes each. So it took quite a bit of work to condense all this. So I'm going to be moving pretty fast. Maybe not going into the level of detail as you expect on some of these topics, but I guess that's what the Q&A time is for at the very end. So I'm going to reverse the order as it was advertised for this town hall. I'm going to start out talking about a basic vaccination program in the cow-calf herd. Then I'll move on and talk about some basics in deworming, and then we'll finish up with fly control strategies. Okay, so a couple of disclaimers I want to make before we get into the cow-calf vaccination program. First of all, I think I've already mentioned this, but this is going to be a very basic program. And so I say that just to point out that there may be other things that you're vaccinating for in your herd. and that's perfectly okay. What I'm going to focus on is what I see to be the basic program or the core of these vaccine programs that most veterinarians are using across the state. It's the one that I used in practice as well. And you can, of course, add on things as necessary. I would recommend having a conversation with your veterinarian if you are going to not only change your vaccine program, but also look at putting additional things in that program. The other disclaimer I want to make is in relation to what I've already said, and that is vaccine programs should really be tailor-made to the specific needs of each operation and how they function. And so I can do the best with what I know about general cattle health, but again, you may have more specific needs in your particular operation. So I'd encourage you to work with a local veterinarian and come up with a vaccine program that is going to be tailor-made to those specific needs. So with that, I guess as I teach vaccine programs to veterinary students, my hunch is that they just want me to come right out and tell them what to give and move on. My approach more often than not is to start out by focusing on what are we trying to accomplish with our vaccine program in the first place. So that kind of helps us get focused on what should be included in that program. So in terms of the cow herd, and we could throw in bulls and replacement heifers here as well. But the primary thing that we're trying to do with that program is reduce the risk of reproductive failure associated with infectious diseases. And so that could show up as anything from early embryonic death to abortion, stillbirths, weak-born calves, so on and so forth. Now, a side effect of vaccinating that mature herd, or especially the cows, is that is going to offer some protection to those newborn calves later on once they finally hit the ground. So by vaccinating that cow, we're going to increase antibodies in her system, and when she goes to form that colostrum, we're going to get a higher quality colostrum out of it, which will again protect those calves or provide some protection to those calves. But at the end of the day, our primary objective is trying to prevent reproductive failures. Now with calves, the two things we're primarily focused on is reducing the risk of pneumonia. More often than not, we're thinking about that around weaning time, but there are some operations that I'll work with that will have pneumonia in calves while they're still on the cows. And so in some of those operations, you will find them vaccinating for some of these respiratory pathogens while calves are still on the cows. And of course, the other thing that we're trying to do with this vaccine program is minimize the impact of clostridial diseases. And so what comes to the top of most people's mind is blackleg, but also in that blackleg vaccine are some strains of clostridiums that can help us protect against enterotoxemia or enteritis in those calves as well. Okay, so with that being the focus of what we're trying to accomplish, here's what I'm considering to be the basic pathogens or antigens that we're vaccinating against in our cows and our calves. So in terms of viral diseases, the two key ones are bovine virus diarrhea virus, as well as infectious bovine rhinotracheitis. I'll let you read what the conditions are that can be caused by these two viruses. And then we're also vaccinating against leptospirosis and Campylobacter, which most of you all would know as Vibrio. Lepto can cause anything from abortions to stillborns to weak-born calves, whereas Vibrio can cause early embryonic death and abortion. Now, two other viruses that we also will include in the cow program is bovine respiratory syncytial virus and parainfluenza 3. Those have no effect on reproduction. Those are respiratory pathogens, and we don't see a lot of pneumonia in cows. So the question may be, why are we including that in the program? And there's several reasons. One, we've already kind of talked about, and that is by vaccinating that cow, we're going to increase the quality of that colostrum. And so those two viruses can contribute to the respiratory disease complex in calves. So that's just going to give us some passive protection. Another benefit of vaccinating the cows for those two viruses, if by chance that virus gets in the herd, it's going to reduce circulation of those viruses just because we've got the cows protected. And then last but not least, when you go out and start looking for vaccines that contain your viruses such as IBR and BVD, they are typically going to include BRSV and PI3 as well, especially if you go out and look for something that's got both your IBR, BVD, Vibrio, and Lepto, just by default, you're going to get BRSV and PI3 in it. So I've got no problem vaccinating the cows with those viruses as well. And we talked about the possible benefits of doing so. Okay, now in terms of the calves, it's kind of convenient that the same viruses that we talked about in the cows also cause pneumonia in calves or contribute to pneumonia. So we're going to think about including those in the program. And then also the clostridials, or what most often people will call blackleg. I'd also like to point out, if you're banding calves, it is probably wise to include tetanus vaccine in that program as well. All right, so that's what we're going to include. Let's talk about timing. This is where it's going to require a little thought on your part. Not all that difficult. I'm going to come at this from pre-breeding, calf processing, as well as preg check time and weaning. So if you're a spring calving herd, next stop in your production phase is you're thinking about pre-breeding and calf processing. Inverse would be true with your fall herd, looking at preg check and weaning here before long. So with the cow vaccine program, here's what I'm going to focus on at pre-breeding, and that's going to be the 4 viruses as well as Vibrio and Lepto. I understand that, there's some people that will vaccinate annually at preg check time with those viruses. And I guess if that's the only time that you can do it, so be it. But my preference for including these vaccines pre-breeding or administering them then is because some of these diseases have an impact early on in gestation. So my mindset is I like to have the highest level of protection going into that early phase of gestation. And then that's going to give me the greatest benefit if by chance there's an accidental exposure that occurs. Now, at preg check time, the main thing I'm focused on at that point is basically Lepto. Primary reason why Lepto is included again, even though I administered it at pre-breeding, is because it notoriously has a short duration of immunity for the most part, somewhere around 6 months. And being that Lepto problems will normally occur from mid-gestation on. There are some exceptions, but that's a general rule of thumb. I like to come back and give Lepto at that preg check time just to carry me through the rest of gestation. Could be an individual decision. Some people will vaccinate for these viruses twice on a yearly basis. That would be a discussion to have with your local veterinarian, whether that should be done in your particular operation. Now, in terms of calves, at calf processing, for those operations that have issues with calf pneumonia, I may include the viral vaccines in the program at calf processing time. But at the minimum, I want to get blackleg in those calves. And then next time we see them is going to be around weaning time. And I'm going to go ahead and repeat the blackleg. And I'm also going to give my virals at that time, even if I have done it at calf processing. Okay, so that's the nuts and bolts of the cow-calf vaccination program. Probably bears talking about the bulls a little bit, since they're a big part of the system. And so I look at vaccinating them as quote unquote pre-breeding as well, prior to turning in with the cows. And so I'm just going to use the cow pre-breeding program on the bulls. Again, that would be our viruses as well as Vibrio, Lepto in those animals. And then, of course, I'll just throw out pink eye here. If anybody's going to be pink eye vaccinating, regardless of whether you're spring or fall calving herd, now would be the time, since pink eye risks are greatest in the summer months. Right, so moving on to talking about parasite control in cattle. I've kind of gone back and forth as to exactly what I should talk about in this segment. There's a lot of discussion surrounding parasite resistance right now. And there's some strategies that are being discussed to how we can minimize the emergence of resistance. I'll talk a little bit about that at the end. Not going to go in as much detail as maybe I would like, but I think where I'm going to focus on for the most part is just some general thoughts in relation to parasite control, parasite populations, and look at the different types of dewormers out there that we have and do a quick comparison just to kind of give you maybe some practical information that would apply in the immediate term. So talk a little bit about the dynamics of parasite populations. Basically, they have two functions. Okay, one is to live off the animal they invade. Okay, so I was watching a presentation a while back. Roughly about 70% of a parasite is intestine. The rest of it, or the lion's share of the rest of it, is reproductive. And so these parasites, in order to grow and reproduce, they do a lot of feeding, which obviously is going to affect cattle performance. And then they've also got this goal of reproducing. And so this reproductive goal is to produce as many eggs as they possibly can. Depending upon the parasite, that could be 1,000 eggs a day, so that they can cause maximal environmental contamination so that their species survives. Now, this parasite survival is definitely seasonally oriented, in that there's certain conditions under which parasites thrive, and there's other conditions in which they have to basically go into dormancy so that their species does survive. And so parasites can arrest development in cattle so that they're not producing eggs when environmental conditions are not favorable. If they have produced eggs and there's eggs out in the environment, those eggs can arrest development during these times and wait until favorable environmental conditions return so that they can hatch and they can become infective larvae, which can then reinfest your cattle. Okay, so egg development is highly dependent upon temp and moisture. So what the importance of that is that eggs that are passed in the middle of winter will not develop until warm weather in the spring. And then eggs that are passed in the middle of summer during drought may not develop into infective larvae until later on. Sometimes these conditions could get severe enough, I guess you could reduce the egg contamination upon the pasture to some degree, but my understanding is these eggs are pretty resilient to environmental conditions and just wait it out till those favorable conditions return. So here's the key times that these eggs are really active, and that's going to be spring and early summer. So as we see forage growth start to come on, that's when the majority of egg laying is going to occur. That's when the majority of egg development is also going to proceed. It will slow down as we go into the summertime, and then it will return in the fall when cool weather and ample moisture return. So as you look at this pasture contamination with parasites, and you can also think about the activity of the parasite within the animal in terms of egg laying, it's almost follows what, if you've seen our fescue growth patterns here in Missouri, it almost follows those patterns. So your highest, again, contamination and activity is going to be in the spring of the year. So with that, kind of the recommendations are for when to deworm is that if you're only going to deworm one time a year, your best option is going to be the springtime, when the majority of the parasite population is going to be present. You're not only trying to address parasites that are in the animal, which in the grand scheme of things represents about 10% of the total population, but you're also trying to address the parasites on our pasture, which represents the other 90% of the total parasite population. If you're deworming in the fall, basically the ideal time to do that would be when around the time when those favorable conditions are returning. I'll also throw out is that any new cattle coming into the operation, just so that you may reduce contamination that they could provide, you would want to deworm them at acquisition, maybe give them about 48 hours before you turn them on pasture so that your anthelmintic or dewormer has time to work. In terms of deworming calves, kind of the cutoff, if we are deworming calves, is suggested nothing less than 200 pounds. If you haven't dewormed calves sooner than that, or sooner than weaning, by all means at weaning time, that would be an ideal time to do it. Okay, so let's move on and talk a little bit about the difference in dewormers and wrap it up with parasite resistance before we move into fly control. So there's three main drug classes of dewormers out there. Some of the older generation classes are the imidazoles, which many of you all may remember the levamisole. It's still out there. It's not used very much. Then there's also what we call our white drenches. These are have a place, I guess is the best way to describe it. There is some limitation in efficacy. Another drawback to these dewormers is that duration of effectiveness is very short. The next class of drugs that we have is the newer generation dewormers called the macrocyclic lactones. Those include your avermectins and your milbemycin. So even long range, which is the newest quote unquote dewormer that we have in the marketplace, falls under the macrocyclic lactone class. And basically it is injectable Epernex that's just formulated for a long-term release. And so one challenge that we're running into when we're talking about resistance is that even though this macrocyclic lactone class is the newest class that we have, the first one that came out would have been Ivomec, which is over 30 years ago. And everything that has come out since then has been in that macrocyclic lactone class. And the challenge with that is that if you've developed resistance to one drug within that class, then you're also going to have resistance to the other drugs within that class as well. So changing from Dectamax to Epernex isn't really going to fix the problem if you've got resistance. Okay, so we'll come back to a little bit more about resistance here in a bit. Okay, so this is my attempt at doing a comparison between Porons, injectables, and drenches. So on what I've tried to portray here is that one would be, I don't know, ideal or favorable. Two would be less so. Three may be the least of the three. And so when we look at Porons, they're by far the most convenient. I would rank injectables as number 2, drenches number 3. Cost, you can kind of look through that one. Spectrum of activity. So Porons would have your greatest spectrum of activity. They're not only addressing internal parasites, but they also will address biting and sucking lice. Whereas your injectables, yes, they address internal parasites, but they only control sucking lice. You go to drenches, they're only controlling your internal parasites. Residual activity, typically your Porons may give you a little bit longer residual activity than your injectables, with long range being the exception. And then product utilization, this is my opinion, but injectable is going to by far give you the highest level of concentrations when compared to a Poron. And I'm not downplaying Porons, other than to say those products have to be absorbed. And so that is going to have the potential for reducing the amount of active ingredient that gets into the animal. And so on that note, let me jump to the Poron tips. And this is just kind of a accumulation of thoughts over time. In my personal opinion, the number one downfall of the Porons is their convenience. And what that convenience leads to is sloppy application. And I guarantee you that Poron that is on the side of the chute or on the ground or running off the side of the animal is not going to be absorbed. And I have seen a lot of sloppy application out there. So if you're using a Poron product, don't be in a hurry. Apply that product in a thin line from the shoulders to the tail head and prevent that runoff from occurring. And that will give you the greatest efficacy from those products. If you get sloppy, that leads to underdosing, not as good as efficacy. And you've also got the potential for potentiating resistance. Okay, so in resistance world, big discussion currently because we are seeing resistance start to emerge in the US. First documented case was in 2004, and as they continue to look for it, they're finding it more and more often. So what is resistance? It's basically the failure of your dewormer to kill a certain level of parasites in your population on your farm. And so oftentimes what they'll say is if you're a dewormer, so they'll do what they call a fecal egg count reduction test. I won't go into the details of that, but if your dewormer fails to kill more than 90% of the parasites, then you may be at the risk of having resistant problems emerge. Resistance is basically a genetic trait. So what happens over time is that through continual pressure on a parasite population, or on a population of parasites, what we wind up doing is we wind off killing parasites that are susceptible to our drug, leaving only resistant parasites behind to reproduce and populate the earth, so to speak. And so again, there's a lot of conversations surrounding strategies to minimize parasite resistance. Refugia is one big strategy that's being discussed. I don't have time to go into that. That may be a topic for a later date. But here's some things that I would encourage you to think about in the near term. So one, these are some of the clinical signs that you would see outwardly in animals that may be experiencing resistance. My argument would probably be if you start seeing some of these problems, resistance is already on your place. The best way to do this or check for resistance is through a fecal egg count reduction test. That would be something that you would do in conjunction with your veterinarian. But just some kind of things to think about when you go out and deworm this spring or whenever you do it. First of all, underdosing is one contributor to resistance. So if parasites are being exposed to lower amounts of drug, it may not kill them, and they may survive and develop resistant mechanisms because of that. So a challenge that some people have is not having scales under their chute, so they'll deworm based upon an average body weight. And so you know what happens when you deworm on an average, right? You're going to undertreat a percentage of the animals, a fair percentage of the animals, and you run the risk of not only having poor efficacy of your drug, but also, perpetuating resistance. And then I think the application of porons or just the dewormers themselves should also enter into that conversation, making sure that you're applying them correctly and, of course, dosing them correctly as well. Okay, so I better keep moving. I've lost track of time. Where am I at?
You have about 15 minutes.
15 minutes. Okay.
10 to 15 minutes. We're fine.
All right. Okay, so we'll finish up with fly control strategies here. Two major fly species that we're going to deal with in cattle are going to be horn flies and face flies. So with horn flies, you can identify them simply by where they're located at on the animal. So they're going to be found in the shoulders, neck region, maybe on the underbelly. If it's raining, they'll move down to the underbelly to feed. Of course, face flies, their name indicates where you're going to find these primarily. By far, your horn flies are going to represent the most significant economic impact. And that's because of the aggressive feeding behavior of that population. So they require a blood meal for reproduction. And so when they're feeding on these animals, which they do quite frequently, as the slide says, that creates a lot of stress in the animal. So you lose feed consumption or decrease intakes. You'll have decreased milk production. You can have decreased weight gains. They call this whole syndrome fly worry. It's this activity that cows and calves will do in order to try to address the fly population themselves if there's no insecticides being used in the system. It's not that face flies are not important. I mean, where their role is at, or where our concern is at with face flies, is their potential to contribute to pink eye issues. But again, at the end of the day, horn flies are what is going to create the biggest economic impact on these operations. I guess I've seen in some stocker cattle studies that, calves that had fly control versus those that did not would gain anywhere from 15 to additional 30 pounds during the grazing season. Okay, so methods of fly control. Your familiar with most of these, but as I go through this, maybe I can give you a few things to think about that will help as we go into this fly season. Fly tags by far the most common control method. As you all realize, these tags are embedded with either an organophosphate compound, or or the other option would be a pyrethroid. How these tags work is that insecticide released from the tag, it just doesn't only stay up in the head and neck region, it actually disperses across the hair coat of the animal. One thing that I found very interesting about fly tag and their ability to control populations of flies, as talking to people that sell fly tags, is that they will receive a lot of complaints after rain events, because what will happen is that will wash that insecticide off the animal. At the same rate, we also have an emergence of fly population because of the increased moisture. And what will eventually happen is that insecticide will redisperse within 5 days to a week, and you'll go back to a control level as long as your tag is still effective. So if you do experience that and you've placed fly tags, don't run to the phone and call your animal health representative. Just give it a little bit, and those will go back to a level of fly control that you expect. In terms of effectiveness, it really depends as the resistance to the compound in the tag that you're using or not. We'll talk about resistance here in a little bit in flies. Duration, you'll see it advertised for some tag companies, or for some tags, maybe out to 5 months. Probably a more realistic expectation would be somewhere around 12 to 15 weeks. When to apply fly tags. So, if you apply them too early, obviously, by the time you get to the end of the summer, when fly control populations start to reemerge, compound is going to be paid out, and you're not going to get the length or the control that you expect. So the recommendation that people will often make when applying fly tags is to do it when the fly population reaches about 200 flies per animal. And the expectation is you're not counting flies, but that would represent about the number of flies that fit in the palm of your hand. And then, of course, the other time in which you could apply that fly tag is, if you notice cattle starting to experience that fly worry concept. So stomping, grouping up, twitching tails, licking their backs all the time, just trying to address those fly populations, you could apply tags at that time as well. So number of tags, 2 in the cow, just because of the body size, 1 in the calf. Keep in mind that, if the calves are still paired up with the cows, as the cows groom those calves, some of that insecticide from the ear tag off the cow is going to get on the calf and help provide some control as well. I would recommend using one class of insecticide, either an organophosphate or pyrethroid exclusively, and not mix and match those in an individual animal. Okay, so spray and pour-ons, they can either serve as a primary control method or secondary control. As a primary control method, the expectation would be that for full season fly control, you're going to have to apply those quite frequently. Estimates are anywhere from 7 to 21 days on length of activity. That's going to depend upon a variety of things, however. As a secondary control measure, where sprays or pour-ons may come in beneficial would be, you've applied fly tags, you get towards the end of their efficacy. You just need a little bit to get you through the rest of the fly season, and maybe apply those compounds or that spray or pour-on at that point in time. The one thing I need to throw out there, that last bullet point, there are folks that use the generic ivermectins, some even at half dose, to try to control fly populations throughout the fly season. Go back to what we talked about in parasite resistance. Frequent application and underdosing, half dose in this case, is going to be a great way to perpetuate internal parasite resistance. Okay, it may do a decent job of controlling flies, but we got to think beyond. We got to think beyond the fly population and think about what we're doing to the parasite population if we're using insecticides or those pour-on dewormers for fly control. Okay, so insect or feed-through fly control products. So you've got insect growth regulators such as Alticid, oral larvicides, Rabon. So I'll let you read that, what species of flies that they control and how they go about that. I'll focus on the summary aspect. And so, as you would imagine, adequate intakes are going to be necessary to ensure fly control with these products. You know, you will have people, and you may fall into this category. You know, if you're the only one using a feed-through fly control product in the neighborhood, how good a control is it going to give you? Well, it's going to reduce the fly population to some degree. There's always a risk from fly populations, of course, migrating from the neighboring operation. So all that to say is that really, regardless of what fly control method that you're using, using multiple methods in conjunction is probably going to be ideal. So not only using a feed through, but also tags, that's going to give you the best control that you can expect. And then, of course, you know, there's a certain amount of time it's going to take for this compound to build up in the animal system as well as the feces. So recommendation is start feeding these fly control products roughly about 30 days before fly season begins. So if you're planning on using these and you haven't started feeding them yet, it's probably time to start thinking about doing that. Back rubbers, dust bags can be quite effective if cattle are forced to use them frequently. That's sometimes the challenge associated with using these types of methods. But also keep in mind, these are going to require recharging about every 2 to 3 weeks just to keep them effective or to be beneficial throughout that fly season. So I don't have much information on these, just other than to throw them out there and say these are some other things that people have talked about. Probably most important off this slide is that some of these methods, they may work, they may not. We just really don't have any evidence one way or other than, you know, just hearsay, whether these strategies are effective or not. Okay. So I'll kind of wrap it up talking about resistance in flies, and this is a challenge or a problem that we deal with. So in terms of, just like with parasite populations, continual exposure to a drug will also drive resistance in fly populations. So the information I've been given is that with pyrethroids, you will start to see resistance develop within about 2 to 3 years. With the organophosphates, it takes a little bit longer, 3 to 4 years. So when they're talking about rotation of chemical classes, a lot of times people are thinking of fly tags. The recommendation is you use 2 years of organophosphates and then 1 year of a pyrethroid, and then you go back to the organophosphates for 2 years. One thing that you will notice with the organophosphates is they don't necessarily do a good job at controlling face flies as what the pyrethroids will do. So you may have to just grin and bear it during that time. The main focus, of course, is going to be the horn flies because of their economic impact. And so your face fly populations, to my understanding, are going to be a little bit higher when you go to that organophosphate rotation. Just like we've already talked about, low dose of insecticide contributes to this resistance. So timing of application is important. Go back to fly worry or 200 flies per animal. We apply our fly tags then. That gives us good control through the fly population. Maybe follow up with a pour-on or a spray at that time that begins to pay out. If we put those in too early, again, as we get far down the line, there's just going to be a low dose of that insecticide coming from those ear tags towards the end of their payout period. And what fly populations are being exposed at that time are going to be exposed to low levels, potentially potentiating that resistance emergence or speeding it up. And so that also means that when we come back in the fall, if we've applied those tags, we need to be cutting them out in the fall just so that, again, we avoid that low dose exposure. Okay, so I've gone through veterinary medicine, parasitology, and entomology. You've tested my knowledge of all three categories. So I'm going to open it up for any questions that you all may have.
Dr. Payne, we've got several here in the chat. So the first one that I received was any advice for horseflies in general, horsefly control, that is.
Yeah, so horseflies are a whole different ball of wax. They're very, my experience with them is they're very resistant to the compounds that we use. And so it's a little bit old school and requires some work, but a horsefly control method that, to my understanding, can be quite beneficial is those walk-through horsefly or a horsefly trap. There's some old extension pieces that talk about how to build those. They're evidently placed between the woods where horseflies are going to reside the most at, and where the livestock are going to be housed at. And there's the way those systems are built, the horseflies fly to them, and they never make it out the other side. That's the quickest summary I can give of those traps. It's been probably 2, 3, 4 years since I read anything about those, but they are extremely difficult to control with any of the insecticide products that we've had or that we have. So looking at those horsefly traps may be an option.
Okay, the next one, if you don't want to take it, I'm happy to, since it's kind of a nutrition question. Which is more effective, feeding Alticid minerals or feeding Alticid protein lick / mineral tubs?
Yeah, why don't you take that one, Eric?
Okay, so my perspective on the comparison of the two is consistency of intake. The biggest downfall that we have when we try to feed Alticid through any kind of feed product is that, if not every animal consumes it every day, or at least according to label recommendations, then we can have some uneven control across the herd. And so that question's a little bit subjective in so much as if you're using one and the cattle seem to be eating it, it seems to be working pretty good, I'd probably stick with it. Now, the only time I would choose the other option is if one isn't working. From my perspective, cost-wise, I'm guessing that the mineral tub is going to be even more costly than the mineral containing the Alticid, even though that mineral is probably a $32 to $35 a bag mineral itself right off the bat. The protein lick tubs are probably going to be priced, oh gosh, I don't even know what they would be per tub, but I'm guessing they'll probably be around $1,200 a ton. So I'd probably start with the mineral, and I would only consider the tub if I was getting some uneven consumption of the mineral, or I was noticing that it wasn't very effective, that the cattle were still being infested with flies. Although I understand that if you don't have this product out 30 days beforehand, you may not get good larvicide protection early on. So you kind of have to troubleshoot if you do continue to have a fly problem with Alticid. Was it the way it was managed, or was it a lack of consumption by the animals? So
appreciate your input.
The next one is used motor oil on back rubs, effective or not, ? And then the follow-up with that is, what if you mixed coral or other fly control sprays with it?
So I'm not aware of anything suggesting that used motor oil would be a strategy that would exceed that of some of our insecticide compounds specifically labeled for fly control. I guess that, being that we're not dealing with lead-based fuels anymore, we don't have to worry about that. But the used motor oil, would there be some concerns in relation to some contaminants there that I wouldn't necessarily want to expose my cattle to. So my preference would be to stick with something that we know is going to be efficacious for a back rubber.
All righty, those are all the. I have one more personal question. So
Sure.
you made a comment about non-chemical approaches needing scientific evaluation. I'm assuming that apple cider vinegar would fall under that category. I've heard some interest in it, and I get questions about it, and I'm highly skeptical, but yeah.
You could throw in that mixed garlic as well, right? That's another one that is being thrown around as a possibility. The
sad thing is, Craig, that there's actually a little bit of garlic data out there. I've seen 3 studies now. There was one in Canada that showed pretty dang good control of it, but it wasn't exactly what I would call a well-designed study.
Right.
There's 2 other small abstracts that I've seen that showed a little bit of protection from garlic. I guess from my perspective, I'm more willing to give garlic a chance than I am apple cider vinegar.
Right. And I guess that, to that point, I hate to come right out and say, well, something like apple cider vinegar wouldn't be effective. And I'm not aware of any studies that have looked at that. It very well may be, but we just don't have any evidence. And so we do have some evidence of, what strategies or compounds do work. And so, from that standpoint, you just kind of have to weigh how much risk you're willing to take if something like apple cider vinegar doesn't do a sufficient control.
Awesome. Thank you, sir. I don't have any more questions.
Okay.
All right. Thank you very much, Dr. Payne. We appreciate you trying to cram a whole semester long course into a half an hour for us. We appreciate you giving us those highlights. Jill Scheidt found that guide sheet that you were talking about, the horsefly trap guide. And so she dropped that link in the chat. So if you have an interest in that information, check out the chat and you can find that guide sheet there. And so I'm going to share my screen and wrap things up here. We appreciate everybody's, Dr. Guinan and Dr. Payne helping us out today and giving us really timely information. If you missed any of our past broadcasts in the month of April, we have posted those entire recordings on YouTube. And so here's a list of the topics that we covered in April. And so you can go in, catch those entire programs from April. And also, as well as some of the video clips from programs that we have had in the past year. We started these about a year ago. And so we have a clip from nearly every week of a video clip from the 2020 events, as well as the recordings for the April entire programs. And so you can view those there. We want to thank you all for joining us today and let you know that next week, Dr. Scott Brown is going to be talking about the livestock markets 1 year after COVID. And we hope you can join us then. And I also want to thank the team of regional and state extension specialists, as well as our IPM team who helped make all of this possible. So this is a team effort and we appreciate everyone's help and glad you can join us. Hope to see you next week.